dialogues. Now, our pedagogical approach was intentional. We wanted to foster international, intercultural dialogue across regions and lived experiences, and we wanted to frame climate justice through inequality, colonialism, and occupation, given that our students live under occupation in the West Bank. And we wanted to apply decolonial pedagogy that centers marginalized voices and promote collaborative project-based learning and empower youth through digital civic engagement and action. Now, our study is a qualitative one. In terms of our methodology, we followed a qualitative approach and we relied on key informants, interviews, student reflections, and final reports. And this allowed us to gain rich insight into student outcomes and their transformation. Now, here is a sample of 1 week. I'm talking about the material here on the website, on the platform for the students to access. This is a special course because students didn't only from the content of the material that we gave them, but we provided them with a genuine interactive experience where they had to learn from each other as well. So the weekly online dialogues connected students from Europe and the Southern Mediterranean, including Palestine. And as you can see here, we have this topic. It's an important topic in intersectionality. We had some audio-visual materials as well as some short readings for the students to do. And of course, interactive dialogues were a central part of every synchronous meeting. Climate action project was also a very important and I would say the most important element in our project because students had to actually take action, not just learn about climate justice, but also to take action to combat climate injustice in Palestine and other places. So they had to do one of 3 tracks. The first track is the social track, the social action track, and the second one is the political action track, and the third one is the environmental action track. And they had the choice. They could choose any of these tracks. And as you can see here, I included a sample of 2 projects, one between my students and students from Morocco, Rising Tides, Amplified Voices, and the Global Climate Awakening. And the second one is also raising awareness, and it was a joint project between my students in Palestine, the West Bank, and students in Italy as well. So here are my students' outcomes. As a result of our analysis, we identified 3 main themes. The first one, through this virtual exchange program, we were able to enhance our students' understanding of intersectionality and climate vulnerability. We also were able to reinforce their recognition of systematic injustice and global inequality. And we were also able to improve their personal transformation and sense of responsibility. And you can see here some reflections from my students. I will highlight the first one, which is about intersectionality. This is a student from Al-Najah University in Palestine. Gives this reflection that a poor lady in a conflict zone, for instance, may be far more vulnerable than a person who lives in a safe and wealthier neighborhood. So this highlights their understanding or her understanding of intersectionality and climate vulnerability. And let me also highlight the second student. He says that Israel's blockade bans solar panels in Gaza, yet subsidizes settlers' green energy. So again, this shows my students' recognition of systematic injustice and global inequality. And finally, the last student says, I no longer see climate change as the main problem. Instead, it's about convincing broken systems built on the sacrifices of others to care. Our generational fight is about changing the foundation entirely. So clearly, this shows her sense of responsibility about doing something, taking action to combat climate injustice in Palestine. Thank you very much for listening. This was my presentation, and I welcome your questions. Thank you very much.
Thank you so much, Dr. Zawawi. We will have the question section later on, so you can off the share screen for now, and then we will have Ms. Surmion, and then I would like to have your sharing. So feel free to share your screen, Ms. Surmion from Philippines, and her topic that I can upfront to remind. That will be about exploring the impact of collaborative COIL on intercultural competence. And would you like to share screen, please? And plus
Yes,
is
ma'am.
professional readiness. It's important that we will covering about cultural exchange initiative between pharmacy students from the Philippines and biology students from Thailand.
Is my share screen already visible?
Does she have the share screen? No. You have the right, try again.
Okay. Oh, sorry. I forgot to share my screen.
We got it. You can have it
Okay.
full screen now. Let's press the, yeah.
Okay. So my topic will be about exploring the impact of collaborative online international learning on intercultural competence and professional readiness, a cultural exchange initiative between pharmacy students from the Philippines and biology students from Thailand. So to give you a background, our students in Holy Child Central Colleges are from indigenous tribes, mostly are from indigenous tribes that is located near our school. So most of them did not had a chance to go abroad or to travel. So COIL gave them a chance to meet other people online without leaving their houses or without leaving Sorana. So effective cross cultural communication and collaboration are now crucial in today's global society, particularly in science-based disciplines like biology and pharmacy, where cultural context has significant impact medicinal procedures. So, our partner for the COIL is the Prince of Songkla in Thailand, and we have discussed. We have in because they are biology students, we look for a subject that we could collaborate with them. So from that subject, we chose botany. So in botany, we discuss about the different taxonomy and the different plants available in the herbal plants available in the Philippines and available in Thailand. So, however, many students in underdeveloped nations such as the Philippines still have restricted access to physical study abroad programs. In response, collaborative online international learning provides a virtual inclusive option that promotes global learning and intercultural communication because our school is a grantee of the CHED, a smart innovation laboratory wherein we were given 30 uh, Mac computers to use in COIL conferences. So this study examines COIL projects that focuses on ethnobotany and the traditional usage of medicinal plants and involves biology students in Thailand and pharmacy students in the Philippines. So there have been 19 students from Thailand and 30 students from the Philippines. So students learn about traditional healing methods that the scientific use of medicinal plants and the significance of cultural beliefs in healthcare through virtual cooperation. So during the COIL program, the students have learned that like Thailand, the Philippines and Thailand both practice traditional medicine. We are transferring knowledge through the word of the mouth. So we are also the same in which we are using herbal plants in treating our diseases. And we also have governing bodies such as the Department of Health that regulates our health program. So this study examines the project that the study assesses how the COIL experience affects students in intercultural competency, professional preparedness, particularly in the areas of teamwork, communication, digital literacy, and flexibility. So we conducted COIL for us to also learn if this study for us to learn if our students have improved their skills. If those skills that they have gained during the COIL program um, has improved that they could use in looking for jobs in the future. So the findings add to the expanding corpus of research on virtual internationalization in health sciences, education, and show that COIL is a promising instrument for producing graduates who are globally receptive and culturally competent. So methodology. After our COIL program, we have, I think, 4 sessions of COIL. One in which we had the introduction of the students. They get to know and they regroup. So after the regrouping, they were given 2 sessions for them to meet and for them to make their project in which they consolidated at least all the herbal plants available in the Philippines and available in Thailand, and then they explain what are the traditional use and how are they being prepared, and of course its taxonomic classification. So after our COIL program with them, we conducted this study. So they were given handout. They were given this questionnaire via Google Forms, sorry. They were given questionnaires through Google Forms for us to know um if there is a change in the professional preparation for communication, teamwork, digital literacy, and flexibility, and also the intercultural competence. So we use a 5-point Likert scale for this, and we use a standardized questionnaire for this also. So the results, the study assessed the impact of collaborative COIL initiative on intercultural competence and professional readiness. Teamwork 3.83%, which is the highest, meaning the students, even though they are from different countries and different time zones, they develop a teamwork. They have different languages, and one of which we encountered is that um, during their COIL program, students from Thailand, so that is why the communication is a bit low with 3.54%, because students in Thailand were taught English during college, whereas here in the Philippines, we are taught to speak English as early as elementary or basic education in our basic education. So there is a communication barrier, but because of the teamwork and the intercultural competence and the digital literacy of our students, they made it work. They made the COIL program happen. So among this, teamwork emerged as the highest rated domain, suggesting that students felt confident in collaborating with peers from different cultural and academic backgrounds. Scores for intercultural competence, digital literacy, and communication and adaptability were relatively balanced, ranging from 3.54 to 3.58, indicating moderate to strong development across the competencies. So, as a sharing, was the first time our students had a COIL. So their first time is a COIL with Thailand, but recently we had a COIL with Hawaii. With We had a call with Hawaii. It is made more on marketing and administration. So after this first call program, our students gained confidence, and they were used to doing COIL. So even then, they met new friends. They had exchange contacts. So that is one of the good thing about COIL. Our students made friends across the globe. So for the conclusion, in virtual interaction with Thai biology students, this study discovered that collaborative online international learning greatly improved the intercultural competency and professional preparedness of Filipino pharmacy students, while intercultural competence of 3.58, digital literacy of 3.56, communication at 3.54, adaptability at 3.54 shown moderate progress, teamwork received the best score of 3.83. So our students acquired knowledge of ethnobotanical methods, cultural sensitivity, and self-assurance in working across cultural boundaries. So the findings support the inclusion of COIL in health sciences education and demonstrate its efficacy in producing globally competent health professionals. So not just building we are also building the confidence and the globally competitiveness of our students, so that is what why we are doing COIL. So again, thank you for listening, and for future collaborations you can email me at kjsormion@heci.edu.ph. So again, thank you for listening.
Thank you so much. So Kimberly, good job. You have keep the time really well. May I double check again? Here I see De La Panya, or otherwise the presenter that I'm expecting will be Kabingting. Will Kabingting be ready? Then you can share screen.
Hello, good evening from the Philippines. Yes, I am
Oh,
ready
there
and
you
I
go.
can share my screen.
Yes, yes. Let's give you
Okay.
we okay to give the rights to share screen?
Thank
Kabingting
you.
is, yeah, sure. In the meantime, maybe I will update and let us know it is about universal health coverage implementation. I see your screen now. You can put on the full screen. Lovely. Thank you. The time is yours.
Hello, good evening, everyone from the Philippines. Am I audible? Yes, okay. So I'm glad to be giving you this presentation this afternoon, and I hope to be brief. So, my presentation is entitled The Universal Health Coverage Implementation, a comparison between the Philippines and Thailand. To give you a short introduction about myself, my name is Gab. I'm a nurse by profession, but currently I'm taking an MA in Philippine Studies here at the Asian Center University of the Philippines, Diliman. So I think that's a good way to frame this discussion because health studies came as a natural interest as I was pursuing the social sciences. However, in this process of being an area studies major, I learned that in order to pursue health from a more grounded perspective, we needed to move beyond the hospitals and the clinics, and we needed to take a more grounded and rooted approach. Hence, this paper is a critique of how universal health coverage is actually implemented on the ground through the case study of the Philippines and Thailand. So, again, to begin this, I would like to give you the definition of health according to the World Health Organization. Health is a cornerstone of national development and individual well being. A healthy population is crucial for economic growth, social stability, and prosperity. Essentially, from this definition, we can gather that health is a fundamental human right. Its importance is further reflected in its inclusion in the Sustainable Development Goals, specifically SDG number 3. When we talk about the inclusion of health in the SDGs, for me, enshrines how when we talk about sustainability, health of the individual as well as the health of the population is crucial in order to obtain a national or an overall perspective of sustainability. So when we talk about SDGs, we usually just talk about the overall goal. However, I would like to delve into one of the targets of SDG number 3, namely target 3.8. So this is achieve universal health coverage. So this is just one of the many targets of SDG number 3, because this is 3.8. Talking about UHC emphasizes financial risk protection and access to quality healthcare. So when we talk about UHC, usually the buzzwords that come with it are financial risk protection and quality healthcare. In this way, UHC for many countries, not just the Philippines and Thailand, and not just even in Southeast Asia, but all around the world, it has become a key national policy priority. Its localized implementation beacons sustained commitment towards health equity and social justice. To proceed, I would like to discuss one of my case studies for this particular paper, and that is the Philippines, where I'm from also. So narrowing down to one of the countries that is studied in this paper, the Philippines only started implementing universal health coverage in 2019, and this is through Republic Act 11223, or also called the Universal Healthcare Act of 2019. The stipulations of the act is basically to provide a model that pushes for a comprehensive approach to health that is both of quality and without causing financial hardship. An emphasis in the paper that I like to highlight often is that when we talk about UHC, Universal Health Coverage, Universal Healthcare Act, it always emphasizes that there should be without causing financial hardship, or lack of financial hardship, like that. So, one of the pillars of the Universal Healthcare Act in the Philippines is the NHIP, or the National Insurance Program of the Philippines. In the Philippines, this is also locally known as PhilHealth. So this is one of the pillars of UHC in the Philippines, and this is how UHC, or the Universal Healthcare Act, is usually implemented in the Philippines. So I stressed that PhilHealth is the primary mechanism to pursue universal health coverage through RA 11223. And through RA 11223, people or citizens are automatically enrolled into PhilHealth when they become of age and when they are able to register already. However, in the recent years, again, UHC in the Philippines was implemented in 2019. During in the preceding years, there was also an increase in the contribution to PhilHealth, because people contribute to PhilHealth in order to also have benefits from it. This increase in the contribution started with 2.75 and will culminate in a 5% total increase this year in 2025. The increase is aimed to enhance the benefits that are delivered and covered by PhilHealth. Nonetheless, according to the Philippine Statistics Authority in 2023, out-of-pocket spending, or spending that is usually from the people, from the houses, was still at a staggering 44.4%, while 42.6% is the contribution of the people to PhilHealth. So, as you can see, there's almost equal. There's high out-of-pocket expenditure, but there's also high high contribution to PhilHealth. And according to the figure 2, the table beside it showcases how health expenditure from the government has also lessened since 2021, but recovered by a 0.3 in 2023. Moreover, again, PhilHealth is the primary mechanism of RA 11223. However, it has faced a lot of controversies in the recent years, from leaked data to alleged pocket billions. In addition to these particular controversies, scholarship also points to PhilHealth's inadequate performance, which makes it unable to fulfill its role as stated in RA 11223. So that's basically a brief background of universal healthcare in the Philippines. So moving on to Thailand. In Thailand, universal health coverage started as early as 2002. I believe Thailand was one of the first countries to implement universal health coverage in Southeast Asia. It was implemented through the National Health Security Act DE 2545, and through this law, the National Health Security Office was also established. As you can see on the picture to your right, there are a total of 13 NHSO regional offices throughout the country of Thailand, the Kingdom of Thailand, rather. Um, through NHSO, the Universal Health Coverage Scheme, or UCS, was announced. It is divided into three, basically the CSMBS, or the Civil Servants Medical Benefit, the Social Security Scheme, and other state enterprises scheme, or by the local government schemes in comparative to CSMBS. To give the long story short, um, through USC in Thailand, uh, the goal is for every Thai citizen to at least be eligible for one type of scheme in order for them to be covered by a type of insurance that is by the government. So in 2018, NSHO also launched a 5-year action plan with a vision that all citizens living in Thailand are covered by universal health coverage and access to health services with confidence when needed. This 5-year plan was executed in 2018, and they also had indicators. So the following were the goals, which is divided into three, basically accessibility, financial security, and good governance. In 2019, they already did an initial review of the of the of the action plan, and as you can see, they were met with a positive response. Just 1 year after starting the action plan, they were met with a positive response in various areas. I'm not going to say that it's an absolute positive response, because you can see some red arrows. So they had positive responses in some of the areas just in the first year of the action plan. Moving forward, um, this is supposed to show a picture of um the Thai population classified into the different health schemes that I mentioned. From the 66.616 million population, almost all of the citizens are part of a different kind of scheme. There's one for the civil servants, one for the private schools, one for also those who have disabilities, and the like. In 2022, NHSO also created a PubMat that highlighted all of the achievements that they achieved in that particular year, which is the end of their 5-year plan. So, basing from this particular example, you can see that during the 5-year plan, it may be that not a lot of the goals were particularly achieved, but a lot of the goals were met. And satisfaction, if I can just go back to the previous slide, was really high. They were at a 97.11 level of satisfaction from the patients. So I think that's a pretty high level of satisfaction so far in terms of receiving healthcare from the government. So this slide is supposed to show that UHC, Universal Health Coverage in Thailand, was established in 2002, and it has been a long journey since then. They have had ups and downs. However, they have been consistent in their implementation of universal health coverage, and it has been underscored by unwavering government support. So, in this, I go to my research question. What factors will account for the difference in the performance of implementing universal health coverage in Philippines and Thailand? I've I've tried to locate various sources that could explain this phenomenon. And one of the things that I found particularly interesting was the state configuration. As I looked at the state configuration, I noticed that there were possible explanations for how the differences of the state of the Philippines and of Thailand could explain how how these different state configurations also manifested into the differences of how the healthcare system was structured and executed. So, according to Rakiza 2013, there are two types of state configuration, basically state as bureaucratic polity and proprietary polity. For bureaucratic polity, state power is a blend of political leadership and economic expertise, drawing strength from the country's well-established institutions. For proprietary polity, this lacks strong political organization where political leaders and senior technocrats often operate outside of these structures. The bureaucracy is weakly organized, which leads to the absence of distinct policy boundaries among various stakeholders. To give you a short but comprehensive perspective of how I compare these two is a table. So in my paper, I divided it into four aspects. You have state configuration, health financing, government and political commitment, and healthcare utilization and equity. For Thailand, I characterized it as having a bureaucratic polity, wherein it is centralized and technocratic decisions allowed for the stability and long-term policy goals, which minimizes the impacts of political instability. In the paper that I wrote, I noted how there has been a change of leadership, various changes of leadership within Thailand. However, their pursuance for universal health coverage has been unwavering since it started in 2002 and up until their current action plan to the present. For health financing, this is primarily financed through the general government taxation, and it covers 75% of the population with a minimal out-of-pocket expenses. This is also reflected in the satisfaction rate that was discussed in the previous slides. Again, Thailand's pursuance of universal health coverage has been very consistent. So there is high political commitment to healthcare, and there is also sustained funding for this. And because of the sustained funding and high political commitment, resources are effectively allocated, and healthcare, which leads to high healthcare resources utilization. In comparison to the Philippines, which has a proprietary polity, political elites and economic interests drive decision making. This results in fragmented policies and even uneven implementation. I would also characterize that the Philippine democracy or the Philippine government is very riddled with bureaucracies and um uh, uh different types of strongman leadership, which leads to this type of leadership wherein if you don't have loyalty to the strongman or the patronage, you will not get any kind of benefits. And this is also reflected in further studies that I have done. So again, for in terms of the health financing, it is very reliant on PhilHealth. So as you can see, there has been an increase in the contributions to PhilHealth. However, in the recent years, PhilHealth has also experienced many controversies, and these remain unresolved up until now. So there is wavering trust when it comes to PhilHealth as the primary mechanism for executing or implementing universal health coverage here in the Philippines. Moreover, there is also limited commitment because political elites always prioritize or more often prioritize their interests. And again, the last point is that there is low utilization rates, especially among the marginalized groups as a result of lack of awareness, complex bureaucracy, and high indirect cost. So to conclude, the paper basically highlights the importance of looking at state configuration when we talk about healthcare. State configuration matters because it shapes how decisions are made, who benefits, and how fairly and efficiently healthcare is delivered. A bureaucratic polity like Thailand's allows the government to plan, fund, and manage health programs as a unified system, prioritizing the needs of the whole of the population. In contrast, a proprietary polity like in the Philippines means power is scattered and often controlled by elites or local politicians, which leads to the fragmented services, political interference, and uneven access, especially to the poor. To end this presentation, I would just like to say that in the Philippines, a lot of the services are really reliant on the local government or apart, which is apart from the national government. And without the proper funding and with the patronage that goes on in this particular areas, services just like healthcare are difficult to efficiently deliver to the people who actually need it. So, apologies for extending for a couple of minutes, but thank you so much for listening to my presentation.
Thank you so much. And thank you for staying here so that I can have a chance to present. And here comes, I'm also a nurse, so nice to meet another nurse in pharmacy and also from Palestine about the health equity. So now let me share screen. Okay, well, I promise I'm going to give you a dim sum. That means something that is really dear to the heart because at the end of the section, I want to make it more lightly. However, it is relevant to the conference because after all, we are doing virtual exchange. And I want to say, like when people are going to a wedding, okay, they have the prenuptial, pre-wedding event, isn't it? So that's for people will be more into it so that they won't be shy and also will have a better transition when they get involved. So I'm talking about, I will share designing interactive connection activity to pave the way for successful virtual exchange in nursing education. And I'm from Baptist U, and I'm lovely to share with all of you. But I also have some collaborating partners that I'm going to show you later on. As a background, we are a 5-year nursing curriculum with student size around 90 to 100 per year that our virtual exchange center has established since 2022, and we try our best to facilitate virtual exchange activity with other nursing schools. So I will share 2 cases. One is on Georgia State University that we have it held on our course Health Education and Promotion. The other one is with York University in Canada. The previous one is from the United States, and it's about community and public health nursing. So they are year 2 and year 3 students cohort. Talk about the one with the Georgia State University. We have it again on the SDG number 3 on good health and well-being. And also or collaborating with the course on mental health on Georgia State. They also want to encourage not only on good health and well mental being, but we also talk about quality education. So with this partnership, we have to have some pre-event connection. Therefore, we call it interactive connection activity instead of ice breaking, so that we can make it more interactive and also more specific in related topics. So with the random breakout room event and also the team on the flip grip, we have some activities called meal planning discussion. We use that as a post-COVID, actually at that time it's still with the COVID because it's held in 2023 fall semester. So at that time in Hong Kong, we still have some limitation on the activity. So we have this activity, we call that day cook. Well, we want to say that what if scenario is there's a lockdown and whatever food you have at home, that is the food that you're going to cook with. So we want to see how creative people will do it. But while they are having the breakout room, there will be students from Georgia State U and some are from Hong Kong Baptist U. And they are having some, could be food, not necessarily fresh, but maybe canned food. But it might be a canned food that is not familiar by the other, the Georgia State U University students. So they need to be creative and think out of the box. And with that day-to-day environment, they try their very best to think about people eating is a must, right? So therefore, try to reduce the feelings of loneliness and isolation while enhancing the digital competency, which actually fulfill our summit theme number 2. Other than that, remember I said it's still having the COVID period in 2023, so it's not completely eradicated with the COVID problem. So we want to entice the disaster preparedness mode so that people, they will improve their confidence with self-care motivation in times of isolation. So they have to take stock and brainstorm in coming up whatever food to place on a dish as a potential recipe to share with the community. So creative is important. And that I would like to entice to this morning's keynote speaker, Professor Bazana, talk about creating a generation of globally minded people as the leader in the future who will understand our greatness of collaborative solutions. So with students from Georgia State U and students from Hong Kong Baptist U, but they are both nursing students. So see if they can come up with collaborative solution. Other than that, we also talk about ensure inclusiveness and also equitable equitable quality education, which is the SDG number 4. And we want to promote lifelong learning opportunities. So therefore, we say enhance this internationalization experience through virtual exchange activity. And with this activity, knowledge, reinforcing the importance of lifelong learning. And that is also fulfilling another 2 theme of the summit, which is number 4, on virtual exchange for public health engagement and sustainable action, and theme number 1 about quality intercultural education for our future ready graduates. And for number 17, we cannot work alone. We have to work together with partnership. Therefore, this definitely fosters intercultural exchange with cross-cultural engagement for our next generation that will fulfill our summit theme number 5. And last but not least, on theme number 3, it attracts more collaborators. We will not just stay there. We keep connecting and see opportunity. Therefore, that can help to develop global citizenship in an interconnected world. So other than SDG 3, 4, and 17, I want to recap on this spontaneous process in this team 1. After the day-to-day code, they co-create and generate the creativity, and they need to have some motivation, right? So they will earn the virtual exchange badge from Georgia State U and also the certificate from our Baptist U Virtual Exchange Center afterwards. But of course, we have some lessons learned on challenges. Say number 1 is about discussion initiation beyond cooking. Okay, with that interactive activity, they were talking about see if they can do day-to-day code through our faculty, try to facilitate and try to call some of the students' name if they have included, continue to open their camera so that we can call them. It's easier to engage them. And then we find out that with that discussion on integrating some other topics such as exercise into their daily routine for sustainable lifestyle changes during that lockdown period as a scenario, rather than just keep cooking. Otherwise, they will gain weight, right? They need to incorporate some of the lifestyle changes like exercise. And challenge number 2 is reminder on participation posting forum beyond the deadline. Well, what happened is the activity was talk about day-to-day cook, but it's not necessary talk about later because we have the scenario on health education promotion with some activity, and they need to try to read the posting in the forum and then try to give feedback from the forum. So it was not directly matched with the later participation on the posting forum. Therefore, sometimes before the deadline, we really need to give reminder and reminder. So that was a challenge. So we have to learn from that. And we understand any project, including virtual exchange, that somehow with a design, we need to come with these kind of important points that I'm getting it from Eikenberry's work. It's talking about flexibility, understanding the team dynamics, fostering psychological safety so that students will feel very comfortable to share whatever they are writing with the other counterpart. We all need to collaborate with a clear vision and goals. And number 5 on communicating and collaborating. And of course, the last two is adaptable to any uncertainty. So I guess after COVID-19, everyone, all academic has been very adaptable to uncertainty, and then we will have Zoom, we'll have Padlet, we'll have different ways like Teams to make sure that we will connect it online somehow. And last but not the least, don't just look at the project itself, the process, we can always learn from it. So therefore, the next one, on case 2, when we were collaborating with another university, York U in Canada, we find out that we designed to use the Padlet platform so that we will have an interactive connection activity before we actually have our exchange, virtual exchange. So we start with this taster. And then my collaborating partners are suggesting, instead of saying it's an icebreaker, we want to keep it as an academic connection activity. Make it interactive so that within the group, we will group size around 10 to 14 in the one room. And then in that room, we'll be creating a safe space. And we'll try to strengthen this kind of collaboration and then talk about some interesting activity by starting self-introduction and giving specific instruction on different tasks that they have to follow after the introduction will be needed. So therefore, students later on feel comfortable after this self-introduction, they will be doing exchange of reflective journal. But that's not the focus for here, but we are more focused on interactive connection activity. So here is an example how we are doing the, before the actual reflection, we are doing the introduction first as the task for task A in part A, and then we have part B follow some instruction on doing some of the special tasks, and therefore they will exchange reflection afterwards. So we noticed that during this interactive connection activity, we really see a lot of social connectedness. In fact, we and also York U faculty, we found out that we learned more about our students through that learning activity, that Padlet room. So it's been very positive. Well, there are some challenging experience afterwards, but we are more, we would like to give you some strategic suggestion that really works. So, but we also achieved the intercultural education for those nurses to become future leaders while they feel they are engaging in intercultural meaningful activities through the self-introduction. And in fact, we want to develop this internationalization that we definitely think both personal and professional growth have been seen. So after all, I want to recap again. Today's from another keynote speaker from Professor Aikida talking about the pedagogy of augmentation and curriculum. So I definitely learned something that we can add on since York U would like to collaborate with us at Baptist U, continue on the on our community and public health nursing, so that no matter we will use the topic, say that it is a small talk, icebreaker, or the way we explain is an interactive connection activity. We really think step 1, that's quite generic. And I would like to use the Professor Aikida's idea that we will pretty much synchronize and think alike on that. Is that is important. Step 1 is effectively leverage the technology skills to develop some key competency for the global employability. As we understand, Gen Z will be very much internationalized and mobilized. So it's important virtual exchange, COIL, should be incorporated and integrated into the nursing curriculum. Step 2, reimagine the future skills by AI and how digital collaboration as partnership. Well, I make the AI as red color because I want to let you know that actually in our collaboration with York U, we ban the student from using AI because we want them to be authentic, really come from their mind. So we ask them not to use it so that we want to really listen to their heart. But I think we can try to see how AI, if it's augmented, how we can twist it, but still have the students' originality in that. As for step 3, as a conclusion, how should education evolve to effectively nurture augmented intelligence in future leaders and professionals? Yes, it's very important because for nursing, we are practice profession. We cannot just use the technical skills training alone. We definitely need to augment their readiness to become a nurse, because once they become a nursing student, They are actually walking to the door as the entrance of profession. So we really need to have their readiness early in advance. Therefore, I want to acknowledge both our collaborator from Georgia State U and also from the York University. And last but not the least, we're very privileged, government funding from QESS, and gratitude for your kind attention. Okay, so shall we have, I should stop sharing now. And thank you very much for all your very attentiveness. Let's see how I can make it to all. So that thank you very much for your time. And then we would like to have some sharing of the question time. Would any of you would like to start the question? If not, may I have the privilege to have it in reverse while Kabigting, if you don't mind. I actually have I also read something about the universal coverage before. Yes,
hello,
and that
good
indeed,
evening.
yeah. I know that the Thailand, they do for the even the Aboriginal, some of the Aboriginal in Thailand is called Mani, Thai Mani, MANI. Those people they get the universal health coverage, and that really helps those mountain people. So I'm really happy that I can hear not only on that side but also talking about the Philippines. Now the question for you, I want to know. How come one of the bar chart that you show, Philippine health, that in 20, let me see, I know, 2021, it was like 6.4, but then in 2022, it's like drop 5.6, and also go back up a little bit, 5.9 in 2023. My suspicion, maybe you can clarify me if I'm wrong. Is it because in 2021 is the expense increase because of COVID at that time? So afterwards, maybe the COVID go away. Oh, okay. That makes sense. Okay. So it's not because running out of money. It's just because they don't need to use as much. The COVID is kind of died.
Yeah, actually, I really do agree that going back to the chart that I presented in 2021, there was a really big increase. It was 6.4 in comparison to 2022, which dropped all the way to 5.6. I think this was really due to COVID also, that because the Philippines understood that they don't need to shell out that, the government, to be more exact, understood that they didn't have to shell out that much money because the private sector would also bridge these failures. So I believe that also contributed to the decrease in the government expenditure in 2022. But
see.
again, I think also going back to the point of Philippine politics and the Philippine polity, I think that um there's also this emphasis on the changing agenda of the government, the changing priorities of the government. That unlike Thailand, which I really compared, because in Thailand they were really how do you say this? They were very strong and committed in pursuing universal health coverage. Unlike here in the Philippines, it's very reliant on the leaders who are elected. If health isn't a priority, um of financing or funds don't really go a lot to the healthcare sector. But those are
I
just
have a
my
quick
thoughts.
comment. Thanks
Yes.
for Lapanya. Thank you for her comments that we can see in the chat. Let me read it up front for everybody. Let me see if I can show it again. So chat preview. Oh, I lost it. But earlier she was Lapanya. Lapanya, you can. Why don't you open your mic and then you can speak up. Let me see if I can read that again. Main chat. Oh, okay, I read it. She has a question for Ms. Kabigting. She said, what do you think could help more Filipinos, also for the people in Thailand, especially in remote and marginalized area, in benefiting with the Universal Health Act? And what do you think that can help? Yes, please. Make it quick and
Thank you
brief.
so
Yes.
sorry. Thank you so much for that question. Actually, in a different study, I also did a survey, and I did a study on how universal health coverage was really implemented in different localities in the Philippines. Although it was a small study, and I'm hoping to pursue it more. But in that study, I
Interesting.
uncovered that the barangay health units or the municipal health units noted that there was a lack of cultural sensitivity to indigenous practices. So I think that one way to maximize the Universal Healthcare Act is really to identify problems that are suited to the community and to create solutions that are tailored to tailored to the citizens that are living within the community. I think that the devolution of the healthcare system in the Philippines, they could leverage that in a sense that services are tailored to the priority needs of each community, because I believe that needs per
I got it,
community.
Kabington. So looks like we need nurse advocate. So please make sure you publish that, and then we'll stay tuned about marginalized
Thank you.
members. Thank you so much. How about Ms. Surmion? Thank you so much for your nurses are friends with pharmacies, don't you think? And then I'm so happy to have a chance to moderate one of the pharmacies. So if you have any one more additional note now that you would you like to comment on how pharmacy and nurses will work to improve the cultural exchange? Do you think this intercultural could be possible?
I think yes, ma'am, because we have
Okay, then
subjects.
I would like to collaborate with you. Pharmacy and nurses are
We have
friends.
subject that is the same with you. Yung pharmacology like you.
Yeah. So let's stay in touch, okay? Promise me.
Yes.
Okay, I have a question
No
for
problem.
Professor Zawawi. Professor Zawawi, before we see if we need to ask question, Professor Zawawi, feel free to show your camera. Otherwise, I hope you are listening. I have something to confess and tell you because in previously that I have heard one of the Chinese trying to teach English, a English teacher, Chinese descent, going to Gaza before and trying to teach the children for English. And then at that time, there's one day she used the word trying to share a different occupation, like the job as a teacher, as a what I say. But interesting, all the students are getting very frightened, very scared. They turn their face pale as soon as they heard the word occupation. That really hardened me. And so I remember this, and I have to tell you that because the English teacher originally just want to talk about different profession, didn't meant to talk about the Gaza occupation, those kind of things. So I don't know if you have any comment on that, but we really have our hearts saddened that we really think it's important to have health equity and safety. Your comment, please.
Yes, thank you very much for this question. I think as Palestinians, we need to do more work on, sharing about the reality that has been going on in the West Bank and in Gaza. Of course, as you know, Palestine has been under occupation for about 78 years, and what's going on in Gaza is unspeakable. It's an unspeakable tragedy, and I think part of the problem is we use Arabic words to communicate that. Like, for example, the word Nakba, only Arab speakers understand what a Nakba is. But if we need to come up with new terminology that people in China and people in America and people in Europe can understand. So yes, that's on us. And hopefully now that we have more technology, we have more, methods to actually take photos and videos and share about our story, more people will be sympathetic to our narrative as well. Thank you for the comment.
Thank you. So I'm very glad you're in a position educating the university students. Try them so that they will be a very important advocate. And I'm glad today Professor Basana has actually shared with us about the conflict tracker that one. So we are not just relying on the news, but we have something is more solid. So please continue on your great work with the university students in Palestine. Okay. Okay. So because of the time, and it's getting really late for some of you in your region. So thank you again for joining us today. So we look forward in our future summit, either from your end or our end. So shall we conclude that? We are very, very lucky to have you. Goodbye and good health. Thank you so much. Oh, feedback.
Thank you. Thank you so
Thank you.
much.
Thank
Thank
you.
you so much.
Okay. Okay. Good health. Bye-bye.